Hello, everyone. My name is Mark Kageyama, and I'd like to welcome everyone here to Be Your Own Hero. I'm a stage 4 prostate, bone, and lung cancer patient slash survivor. Been dealing with cancer since late 2020, early 2021, doing very well. It's the end of summer, beginning of fall almost, and it's time of transition here. We're here in Texas, and the weather is absolutely beautiful. It's been really pleasant, which has been this has been a real moderate summer for Texas. I think we've had only about 2 or 3 days over 100, which is great. Right now, it's in the low 90s, high 80s, which can't beat it, and it's great. I am so thrilled, and I think you will be too. Oh, let me give you a commercial first. Please like, subscribe, make a comment in the comment section of the video, so that we can keep bringing you this content. I have a very special guest today, and her name is Erin Bloodworth, and I'm going to let her tell you what all the things that she is because I won't be able to spit it out quick enough. So, without further ado, Erin Bloodworth, please introduce yourself. Tell us who you are and what you do, because this is something that I think everybody will want to hear.
Thanks, Mark. Yes, so by training, I'm a clinical exercise physiologist. I have a bachelor's degree in kinesiology from the University of Illinois. I um, I have a national certification in exercise science, exercise physiology from the American College of Sports Medicine, and I also have a certification in oncology training from the American College of Sports Medicine. So I work with oncology patients. We typically see patients who are in treatment and up to 3 years out of treatment. I work for Northwestern Medicine, and we have a resource center for oncology patients called Living Well. We provide resources for patients at no cost to the patient. Our resources include group-based exercise, individualized exercise, art, touch therapies, group or support group work, one-on-one counseling, and nutrition counseling and classes. So yeah, these programs are for patients regardless of where they're being treated. So if you would like to engage in any of these programs, I encourage you to do so. They're for you, and they're for your family and your caregivers as well.
How does somebody get involved? They just go to the website. In fact, can you share the website? And we will also put it in the description and make sure that people know what it is.
Sure. Yes, they can go to the website. The website is livingwellcrc.org. On that website, you can pull up our current guide. So we're in fall of 2025 program guide. The program guide has every class that we offer in there, and you can look through. Most of our classes are offered virtually, so you could take advantage from wherever you are in the country, and you can access the programs. We, for example, if I'm teaching a chair yoga and standing balance practice, you can take that practice live if you would like. In addition to our live classes, we also have pre-recorded classes on our YouTube channel. And again, you can go to livingwellcrc.org and you can access our YouTube channel and take any of our online classes.
That is absolutely phenomenal. And I wish I would have heard about this resource much earlier, but I'm glad we have it to share with everybody right now. So tell us more about your role and what you do with this organization.
So I provide exercise for patients and for caregivers. So let's start with patients. So for patients, they can access exercise in two different ways through our organization. They can access exercise through group-based exercise classes, A lot of these classes include mind-body classes like Tai Chi and yoga. Um, Caregivers can also access those classes as well because we know that caregivers are there's a lot of demands put on caregivers, and so for them to be able to participate in some mind-body classes and some practices that give them just space, just to kind of find stillness in their mind, is super important. So equally as important as it is for the patient. And so patients and caregivers can both participate in our group-based exercise classes. In addition to the group-based exercise classes, in May of 2024, I started offering individualized exercise programs. These programs start with a fitness assessment. A fitness assessment is designed to help us find a baseline or a starting point for the person or the patient. From there, along with the patient's goals, I develop an exercise program. The exercise program is a
So let me
three,
pause
go
you
ahead.
right there. How do you go about doing that online?
Unfortunately, that one we can't do online.
Oh, okay.
Yes, I know that would be incredible if we could. And maybe, Mark, in 10 years we might be able to.
Oh,
So
okay.
that would be remarkable. Um, yes, so unfortunately, the patients have to be in our area. We're located in just outside of Chicago in a Chicago suburb. And so the patients typically have a 3-month exercise intervention. So they exercise at our site for 3 months using the exercise program that I prescribed. And then we retest. And everyone who has finished the program in its entirety has seen an improvement in almost all of their exercise tests. Um, we have some functional tests, so like the get up and go test. How quickly can you get from a 17-inch chair to a standing position, walk a certain distance, and then come back to that seated position? That's one test. There's other tests that are more fitness based. So arm curl test or the chair stand test. We also do a cardiovascular test, so a 6-minute walk test. So yeah, so there's tests that we do in the beginning of the intervention, and then we retest with those same tests to look at how much the patient's improved in those 3 months with that exercise intervention. So yes, those are the two main ways that patients engage in exercise, group-based or individualized exercise.
Talk about, I'm referring back to our conversation prior to this recording. Talk about the importance of exercise, especially for survivors,
Yeah,
and some of the information that you're sharing.
yeah. So we know that we can use exercise um, in cancer prevention, but we haven't really done a lot of studies looking at after the person is a survivor, what type of exercise intervention is most helpful and why we use an exercise intervention after treatment. So a couple reasons why we use exercise intervention after treatment. We know that if the patient is exercising after treatment, that they are less likely to have a secondary cancer diagnosis or reoccurrence. Um, there was a study that was
Why
just
is
done.
that? Why do you think
We're
that
not
is?
sure about yeah, we're not completely sure of the mechanisms. So when we look at these studies, they're usually breast and prostate patients because those are our largest sample sizes, right? And so we don't have that data yet. The we don't know the reason why. We just know that's the outcomes that we typically see. So, for
Mm.
example, those are pretty easy tests or studies to set up, right? If we have, say 100 people, and half of those people are exercising, and the other half of those people aren't exercising, we can look at outcomes in those two populations. So yes, so we know that, but we don't necessarily know the reasons why or the mechanisms to it. There there are some hypotheses. So we know that people who are more physically active and exercise have lower body weight. And so we do know that is that definitely is a precursor for a lot of cancers. There's also hormone regulation that occurs when patients are exercising, and so we think we're not 100% sure, but that is a hypothesis that we believe that when exercising, it helps to regulate estrogen and testosterone. And so the regulation of those two hormones also helps to decrease the likelihood of a cancer diagnosis or developing cancer. Um, I have patients all the time say to me, Mark, well, I was an avid exerciser prior to my diagnosis and I got diagnosed, right? And so what we do know about patients who were exercising prior to their diagnosis, they were diagnosed much later in life. So instead of the patient being diagnosed in their 30s or 40s, the patient might be being diagnosed in their 50s or 60s if they were avid exercisers.
Me.
Whereas, okay, Mark, is that you? Okay, yep,
Yes.
yeah. So oftentimes, I get that. Well, I was an exerciser prior to my diagnosis, and now I've been diagnosed with this. And and what our research tells us is that, ooh, the likelihood of you being diagnosed in your younger years would have been high if you weren't exercising regularly. So we do know that there are some protective mechanisms to exercise, and it kind of holds that cancer diagnosis off. Yeah.
Wow,
So
that is fascinating.
yeah, yeah. So when we look at survivorship and when we look at exercise and survivorship, we really look. There was a study that was done in Canada recently, and they were looking at survival rate uh, after a cancer diagnosis in survivorship. And so they had a pretty large sample size. It was over 800 people, and they divided the group in half. One was the control group, so one didn't get any exercise. And then the other group had a supervised exercise program. And the group that had the supervised exercise program, they had a much higher survival rate than the control group that didn't have an exercise intervention.
What was the
And so,
approximate percentage? Do you recall?
oh, it was high. It was like the exercise group was like in the 90s survival rate,
Really?
very high.
Wow.
Yeah. Now, don't quote me on that, but because I don't have the study pulled up, but it was pretty staggering. Yeah,
Wow.
it was pretty staggering for those who are exercising in their survivorship. Their survival rate was pretty high compared to the control group. Yeah.
Wow. That is great information to know.
And like I said, this is a brand new study. This was just done in Canada. Canada's really good with their oncology research as far as exercise is concerned. Um, some of our first exercise studies in oncology came out of Canada, and the researchers up there. So they're doing a tremendous job um, for us. So kudos to those researchers.
Wow. That is so good to know. I had no clue about that. And
Yeah,
uh,
I think it should be motivating, right? Like, so
yes.
on those days that you are like, do I really need to go and do this? How important is this? And you know how you try to talk yourself out of it. Bring that bring that to the forefront of your mind. That should be the main motivator. That yeah, it is that important.
I've in talking to some of the people that I've interviewed, that are really into fitness, I keep hearing fitness is great medicine for cancer. Uh, Talk about that aspect and your thoughts on that.
So the American College of Sports Medicine and the American Cancer Society came together American College of Sports Medicine has coined the phrase exercise is medicine. And so they have put a lot of research into understanding, okay, what does this mean? What does this look like? And how, for our practitioners, how do we help them properly gauge the amount of exercise necessary for patients? And so obviously we do have requirements or tools that we use to help prescribe for exercise. But I think the most important component when exercising, either in survivorship or during treatment, is to just simply move your body, right? We know there's therapeutic responses both for the physical well-being and for the mental well-being. Let's be honest, Mark, a cancer diagnosis is mentally fatiguing and physically fatiguing, right? It's super difficult to suss that out, right? How do you know on a day-to-day basis if you are mentally fatigued or you're physically fatigued, right? Um, we can use exercise to help lift that fatigue, whether it's mental or whether it's physical. So usually with mental fatigue, it's cardiovascular training. So anything that gets that heart rate elevated and keeps it elevated for greater than a minute. If it's physical fatigue, we typically use strength training to help with physical fatigue. But again, if you're moving your body in some way, whether it's your strength training, it's your cardiovascular training,
Let me
it
pause
can
you
help
right
to lift
there.
fatigue. Yeah.
What does your strength training involve? Do you use weights or is it using the body as the weight? Because you mentioned some things earlier. Talk about that, please.
Yeah. So strength training can be using body weight. It can be using dumbbells. It can be using bands. It can be using selectorized equipment. So there are lots of options. If a person is in treatment and feeling really deconditioned, they might be using body weight as means of their strength training. Um, there are lots of different ways that you can put your body in different positions where gravity is acting on you and providing you that resistance, right? So when we say strength training, resistance training, we use that terminology interchangeably. But yes, you can absolutely use dumbbells, bands, body weight, selectorized equipment, cables and pulley machines. So there's lots of different options. It doesn't have to be a one size fits all, or there isn't, one that's better than the other. It's really working with either A, what you have, or what you don't have.
Fascinating. Absolutely fascinating. How often do you vary the routine? Because in normal what I used to do in my normal training, I used to vary my regimen maybe once every couple of weeks. What are your thoughts on that aspect?
So we call it periodization. And so it's no different than how we would prescribe for an athlete, right? And so there are some weeks that that athlete might be lifting a heavier weight, right? But then I'm going to take their repetitions down. Or there's a period of time where the patient might be lifting lower amount of weights, and I'm going to take their repetitions up, right? So we can change a lot of different variables based on changing the speed of the exercise, based on changing the sets and the repetitions. So we can change based on that. I also talk to patients about changing just based on if it's a chemo week or not, right? So on
Mm.
those weeks that they might be receiving treatment, their exercise is going to look different than on their week that is right before their next treatment, depending upon, how many weeks are in between treatment cycles. And so just like in an athlete, we would change up their exercise program. We might vary an exercise program for an oncology patient based on where they are in their treatment cycle. Again, the same thing, if I think about a patient who, has been in radiation for so 6 or 8 weeks, right? They may not have had a lot of symptoms for the first 4 to 5 weeks of treatment. They may be experiencing some more fatigue and some more symptoms as treatment progresses because the radiation tends to build up in the body. And so we know towards the end of treatment, then patients really start to see some changes. We also know that sometimes patients are fine up until about a month after their radiation treatment ends, and then they see this onset of symptoms. And so again, we have to program that patient based on where they are in their treatment, whether it be their chemo, their radiation treatment. But yes, we would definitely change up based on where they are in treatment. For survivors, I typically use the 3-month rule. So I would redo and get a whole new set of exercises every 3 months for that patient. So within those 3 months, we can vary some things. We can vary, the weights. We can vary the repetitions. We can vary the sets. But we would keep those same exercises because the patient knows those exercises very well. But we would just change up some variables, and then we would change up the exercises in 3 months. So lots of different ways to go about doing it. But I think that's super important because I always want to encourage the patient, whether they're in treatment or post-treatment, that there are ways to always work in exercise, always work in their strength training, always work in their cardiovascular training. It doesn't have to look the same way it looked prior to the diagnosis, right? Just because you were used to running, 30 miles a week prior to your diagnosis doesn't mean that you still can't find the same runner's high, but we just aren't doing the same volume. We aren't doing that 30 miles per week. We might be doing maybe 10 minutes here and 10 minutes there and breaking it up throughout the day.
So how do you deal with the mental aspect of exercise in that part, depending on the person's individual situation?
I find that that's probably one of the most challenging components, right? I find that avid exercisers prior to diagnosis, they really feel defeated if they can't do what they were doing prior to diagnosis. And I talk a lot about changing your mindset, right? Um, just like we have to change our mindset for other aspects, we have to change our mindset for our exercise as well. Now, when there's a cancer diagnosis, there is so much that's outside of the patient's control, but there are some things that the patient can still control. They can control how they move their bodies, how they fuel their bodies, right? So I really focus on what is in your control and then what's outside of your control, right? It it might be outside of your control that you had chemo yesterday and that 24 to 48 hours receiving that chemo, you are down and you're laying on the couch. That's outside of your control. Um, you can control maybe getting up periodically throughout the day and finding a 5 or 10 minute walk, even if it's just around the house, right? So again, some things are outside of your control, some things are in your control. Choose your battles, pick your battles. And again, this is not the all or none principle. So don't think just because you can't do the things that you were able to do prior to treatment that it's not worth doing. 5 minutes of something is better than nothing. So, sometimes patients have very, very, they have these blinders on where they think, well, if I can't do what I was doing prior to the treatment, then what's the point of doing anything, right? Well, no, it's still beneficial and it's still helpful for you to move your body. May not look like the way you were moving your body before treatment, but still moving your body is more beneficial than not.
Yeah, that is fascinating, absolutely fascinating. And what you're doing for this community is really fantastic. And your whole outfit, providing. And for those of you who missed it, their facility provides free access to cancer patients, which is absolutely incredible. And I love that. And I highly suggest that anybody watching this get involved with Erin's company. And we're going to provide all the information in our description, and I might even put it in the comments as well. So I'd like to get your a final thought for this video. What would you like to leave our audience with? And you could speak to whichever group that you want. And then I have a final question after that.
Sure. I um I want to just highlight how important physical activity and exercise is. Um, we talked a little bit about being more physically active and exercising and decreasing the likelihood of a diagnosis. Or we also talked about kind of staving off the onset of that diagnosis if you were physically active and you exercised. Um, I want to stress the importance of physical activity and exercise. And it doesn't have to be hard. It doesn't have to be challenging. It could be simple, like decreasing the amount of time that you're sitting and increasing the amount of time that you're standing. That might be a really, really easy first step to take. Um, maybe it's just finding more physical activity in your life. So, for example, parking further away from the entrance to maybe your job or your building, or maybe parking a little further away from the grocery store so that you can get more of that walk and that ambulation time in. So, physical activity and exercise, it shouldn't hinder you. It should enhance your life. If the physical activity and exercise that you're doing puts you down for days at a time, then that's probably the wrong physical activity and the wrong exercise for you. It should enhance your life. It shouldn't hinder your life. And so, whether you're in treatment or whether you're in survivorship, I just want to really highlight the benefit of exercise and physical activity. And I encourage you, start small. There's 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 never ever a too small place to start, right? If that means just decreasing the amount of time that you're sitting, that's great. If that means going for a 5 or 10 minute walk, again, something's better than nothing.
The final question. You're very passionate about what you do, and I love that. I love seeing the passion with people who do anything. And I don't care if it's, being a janitor or being a mom or being a teacher. You know, I always feel that whatever you're doing, give it your very best and
Mm.
put your heart into it. And I see that in what you do. You're very passionate about it. So my final question for you is this. If you had special powers, because we always want a better situation. If you had superpowers to do whatever you needed to do to enhance your situation, what would it be?
Oh gosh. Um, I would like to be in multiple places at once because I would love to be able to provide, um, you know, I would love to be able to provide patients everywhere with access to exercise. So I would love to be able to have patients come to me and give them an exercise program if they wish for an individualized exercise program, or come in and take one of our my Tai Chi class, or take my chair yoga and my standing balance with me. Um, it is so motivating to me, Mark, to see someone come in who is either in treatment or in early survivorship. And I describe this as treatment typically puts people in a hole, right? It puts people in this space where they have to then climb out of after treatment. And so whether it be, loss of lean muscle mass, or whether it be, loss of mobility, or maybe even just loss of caring about life or just in general, right? I love that after working with them just through exercise, um, that you can see a physical change and you can see this mental change in the person, right? That, okay, physically they're functioning better. So their overall quality of life has improved because they can do the things that they enjoy doing with their body. But then we also see it mentally as well, right? Like they tend to, stand up taller, their posture is better, they feel more confident in their physical being. Um, so yeah, if I had a superpower, I would be all over the country giving patients everywhere access to exercise, so that everyone can reap the same benefits of exercise during treatment and post-treatment.
That was a phenomenal answer. I love that. Absolutely love that. Erin, thank you so much for your time and for sharing your expertise. Uh, it's been absolutely phenomenal, and I really appreciate it. And I'd like to thank everyone out there for joining us here at To Be Your Own Hero. Uh, Please like, subscribe, make a comment in the comment section of the video. But most importantly, make the most out of your life. We only go around once, and be the best that you can be at whatever you're doing and put effort into it. I think so many of us go through the motions after a while. We get into a routine and things become, you know, lackadaisical or blasé, and because you're doing it over and over and over again. you know Put a charge into your life and inject some passion like Erin has done, and give it your very best, because when it's all over, you want to be able to look back at your life and say, hey, I gave it my all. So with that, make the most out of each and every day, each and every hour, each and every minute, and each and every second. Have a fantastic week, and we will see you next week on To Be Your Own Hero. Thank you very much.